Okay.
So basically, they're running the pie drive this year, and instead of having you come in the middle to everybody, last year got a little bit complicated and some friction developed, and so I think the feeling is that if they can learn as much as possible beforehand and do their research, yeah, I think that will be a wise choice for this group. Is that accurate? So if you think of teaching them what they're going to need to be able to teach to all the other students, and they very much want to have programs based on empowerment. So they're looking at also things like the Heifer organization, which we've never donated to before, but particularly perhaps in areas where they're already doing work. And they'll definitely be allocating funds to your program, correct? To the Uganda Microfinance, because they've got to re-up for that, and double those finances for the ones who have paid back and stayed on time. And so I think it's also a pretty big deal for you guys to know about Ebola, because I think, there are sometimes when you have moderate crises in the world, and sometimes when you have absolutely major crises. And so if you think of the pie drive as being a vehicle through which you can make even more impact than you would have during a minor crisis time, I would play to that, because you're going to be out fundraising anyway, and you have a chance then to create more impact where it's really desperately needed. And so I'll give my personal plea that I really feel like Ebola should be part of. I hope you decide to make it part of what you want to give to. And from what I know with Melissa and AmeriCares, I think they're doing incredible work. So I'm glad. Thank you for taking the time to come and talk to them.
No, I'm happy to. Happy to. So, first of all, let me just tell you why I think this is so pressing. And I was just looking at the New York Times this morning, and there's a great line here that basically says the stark difference in the care available in West Africa and the United States is reflected in the health outcomes relative to Ebola. In West Africa, 70% of people with Ebola are dying, while 7 of the first 8 Ebola patients treated in the United States have walked out of the hospital in good health. So that alone tells you there's a major health crisis that is an Ebola crisis, but an underlying healthcare capacity crisis. What does this look like? In the 3 countries in which Ebola is growing and infecting more people every day, Liberia with 4 million people, Sierra Leone with 6 million people, and Guinea with 12 million people, have so few doctors in their countries. In Liberia, there's 1 obstetrician to deliver babies for the entire country. Think of that.
Seriously?
1 doctor to deliver babies for the entire country.
Which country was this in?
Liberia.
Is that because
4
people
million
get
people.
trained to be a doctor? Because people don't.
It's partly an education problem, yes. It's partly a civil conflict problem. Liberia had decades of civil war, and so a lot of brain drain happened, which is common in many of the countries that we work at AmeriCare. So health systems are incredibly weak to begin with, and then you add an outbreak of a virus to it, and it's very, very complicated. So what I want to talk to you about today is really the 3 things that AmeriCares is doing to confront this crisis. Number 1, it's a capacity crisis, so we are sending doctors and nurses to our partners in Liberia and in Guinea and Sierra Leone. We are doing this by starting with 1 Ebola treatment unit. We are working with an organization called International Office of Migration, IOM. We work with them in many parts of the world, in different refugee crises. They are very good at helping to partner with the local organizations on the ground and get people to where they need to be safe and treated. So we're working with them, and we have sent over the first wave, the first team. They've all been trained by the Center for Disease Control. You've heard that
Yeah.
acronym, the CDC. They've all been trained by them. They are going to work in the Ebola treatment unit for as much as 6 weeks, and then they will return. And based on law, as you've seen in the
Yeah.
paper, they will likely be quarantined in their homes until going back to work. But what you come to realize is that these are extraordinarily heroic people.
Yeah.
And they, there was I wish you could have heard the lecture of the lead team leader. He came and spoke to us for a few hours about the history of Ebola, because he's worked in other Ebola epidemics in his
So this has
career.
happened before?
This has happened before, and so that takes me to a little bit about Ebola. But first, let me just say that we're sending people, because that people are needed,
Mhm.
number one. We're also sending the personal protective equipment for people, not only the people we're sending, but all of our partners in the region, where they do have healthcare clinics, and
Yeah.
they have community health workers. All of those people need to
They're
be
getting the tools
protected. So
to-
millions of masks and
Gloves,
gloves and hats and
Mhm.
gear. That's what we're sending. And then in addition, we're sending treatment for patients. And what do patients need when they have Ebola? It's very much like cholera, in the sense that they need to be hydrated so that their bodies can fight off the disease. So it's really IV solutions, IV sets. Baxter is a big global partner of ours, and they make these solutions, and they've donated them in huge waves. So far we've raised, it looks like about $5 million, and we've sent millions of dollars worth of equipment. This crisis will continue for some time. It looks as if the infection rate is just going to climb through the winter. And I've seen graphs that show us, we're at about 10,000 cases a week now. It could get up to 1 million. Right now, the
There's
graph will
10,000
go like
cases a
that.
week?
10,000 cases that could be new in particularly vulnerable places. So that
every
could
week,
escalate.
10,000
Yeah.
comes up,
Well,
every
that
new
it
one, or every
could.
10,000 up till
It's
this week?
what could happen. So that's what, no one knows, and
But
this
it's
is,
predicted that.
that's what the prediction is. So what they're doing is they're working on a vaccine, and much work has been done, to date to get this vaccine to launch. It won't be available until Christmas time or something like that. Its efficacy won't be known until March. So really there's gonna be a lot of care that's needed in the interim. So we're very hopeful that the vaccine will keep moving. It will be efficacious, and that
Which
we
is a
will
big
be
if,
able
right?
to continue to send more and more and more personal protective equipment, and more teams that will continuously train other teams.
Yeah.
And more IV solutions for patients. Those are really the 3 things we can do, and we're doing all of them.
Yeah. Are they proving effective so far? Or has it not been long enough to see?
I think it's not been long enough to see, and there are certain types of protective equipment that are now being deemed better than others, and so everybody's scrambling to get that. It's
Because it's a new
it's
thing.
moving so quickly.
Mhm.
And yet, you have real successes. I mean, in Nigeria, they basically went to 26,000 homes and proved in the country that they didn't have a new case of Ebola. So they did wipe it out. It is possible to
Wow.
do. and it's been wiped out in every prior case. So I want to tell you a little bit about the history. Where is Ebola from?
Before you start on that, I want to introduce you to Patsy.
Oh,
wow.
This is Patsy.
hi
You
Patsy.
can say hello if you'd like. She's in Stanford and she can get a ride.
Oh, okay.
So,
I'm sorry, Patsy. I'm sorry I didn't meet you in person, but I'm glad you're on the phone.
Thank you very much. It's nice meeting you, even if it's through the phone. I'm sorry I couldn't be there.
Okay, that's okay. I don't know what you heard or what you didn't
she
hear,
was
but
here the minute we sat down.
Oh,
When
okay.
I put it down, she
Okay.
was been listening.
all right, great. So I
So I didn't
just
know what
wanted to
it
make
was
sure
there.
you knew what was going on.
Yeah.
So in terms of